I was visiting England, my little toddler son became ill with an earache and a fever. So I called the local doctor in the village where we were visiting, and despite it being Christmas morning, he came by with a black bag, young doctor, a new tweed coat, a new Ford sedan, not a Mercedes, and with his black bag, checked out my son, determined his condition, gave him something right there for the fever, and gave me a prescription for the antibiotic and told me where the nearest pharmacy was open that Christmas day. And I went to pay him, and he said, "No, here everyone's covered." And I said, "Well, I'm not a subject. I'm not a British subject." He said, "That's okay. Everyone's covered here. It ends up being cheaper for us in the long run." So I went to the pharmacy and got my prescription, and because my son was under 16, they waived the £1 copay. So that didn't cost anything either. This was a shocking experience. It got me digging around a little bit, and I discovered that we in the United States spend 15.3% of our gross domestic product per capita on health care. But in England, they only spend 8.3%. How is this possible? And they cover everybody, including foreigners. But I found out that in Canada, they spend 10%. 2/3 of what we spend, without adjusting for the difference in the wealth of the two countries. Canada does it by eliminating overlapping insurance bureaucracies. They have one centralized insurance bureaucracy that's run by the government, and that provides an economy of scale that gives them the savings. England, to that, adds a further economy of scale by eliminating overlapping healthcare provider-employer bureaucracies. There's one employer, the National Health Service, that employs most of the doctors and nurses. So that's a further reduction over Canada's savings. And Taiwan adds the latest information technology with an encrypted national database. Everybody has a card with a chip on it that's encrypted. And they cover everybody for everything, including foreigners, at 6% of their gross domestic product per capita. Imagine covering everybody in the United States with a more than 60% savings. That's what Taiwan does. We need to learn from all these other countries because they are just beating us completely on how they offer health care to their citizens.